would like to start us off with a quick introduction and background on yourself, that would be great.
Absolutely. Thank you so much, Ansley, and thank you so much, HITLAB, for providing us a space to share our perspectives and our work. My name is Ashley Dominic, and I currently serve as the Program Director of Health Equity for Christus Health. We are a Catholic nonprofit health system with hospitals and facilities throughout the state of Texas, Louisiana, New Mexico, and we also have an international presence abroad as well in Chile, Colombia, and Mexico. So a lot of my role as the Program Director for Health Equity is focused around really figuring out how we can align our health equity goals and initiatives with the different regulatory requirements that we're getting down the pike, especially those from CMS and Joint Commission, and also how we can make sure that our programs and initiatives are in alignment with industry best practices, standards, and guidelines. So just interested to share more with all of you about what we're doing in this space.
Yeah, and of course, on the topic of health equity. So, why is achieving health equity and incorporating an understanding of social determinants of health crucial in the context of value-based care?
Absolutely. So, really, value based care is all about realizing that every person is unique, right? Every person is individual. And then, in order to really improve that individual's health outcomes, we need really uniquely tailored, person centered, and coordinated approaches and interventions, especially as we think about how to take care of that person from the way that they want to be taken care of and meeting them where they are in their healthcare journey. So, at Christus, when it comes to value based care, we really especially emphasize the importance of healing an individual, not just through their body, but through their mind and their spirit as well. And this is what we call holistic healing. And it involves really identifying, what are those medical and non-medical drivers of health that are at play in that person's life and identifying what those gaps are and how we can help mitigate those gaps.
I love the quote where you said that value-based care is not like a one size fits all, right? And I think that's a great way to look at value-based care is, you really need to be able to alter that care per each patient, per each person in the system. So I love that. I think that was a great way to start this off. And can you also share more about your experience where you successfully improved health outcomes for a population with health disparities? And more importantly, how do you measure that impact on equity?
Absolutely. So actually just very recently we started a pilot which we call the prescription food box pilot program. We started this about last summer when we realized that there was a need for assisting some of our clinics in Texarkana, Texas, which is a very rural area. So we ended up partnering with a regional food bank in the area called Harvest Regional Food Bank. So through this program, we're able to provide monthly food boxes to patients who qualify for the program. So these patients qualify because they have a diagnosis of high blood pressure and or diabetes, and they're
Mhm.
also considered to be food insecure, which means that they do not have access to reliable, accessible, healthy food. So by providing these patients with the food boxes, we've been really instrumental in being able to provide them with healthier food options, allowing them to have better quality of life for not just themselves, but for their family members as well. And in terms of health equity, this really helps free our patients up because when they're not worried about food, they're able to live a healthier life by worrying about other things that might be on their mind, right? So you can really see this is just one social need, but it's something that can influence their health outcomes, where they're spending a lot of their time and energy thinking about, and also just making sure that they're able to provide for their families. And that's just food, right? So imagine if you're able to do this for every single social need that's identified
Right.
in a patient.
Yeah. And you kind of almost answered my next question I had for you because I was wondering if you collaborated with any community partners to enhance the effectiveness of these healthcare initiatives. But it's so nice to hear that you are already, in the process of working, and trying to eliminate those food deserts and really just be able to bring that nutrition aspect to the community. When you're able to bring that to the community first, it really can help break down those barriers. So, I mean, in terms of also digital health as well, because this is Digital Health Symposium, how do you see digital health playing a role in addressing social determinants of health also and promoting health equity?
Yeah, absolutely, Ansley. It's so interesting. I mean, since the onset of the COVID-19 pandemic, we've really seen digital solutions like mobile health applications, patient portals, telehealth, right, serve as a critical access point for healthcare providers to reach patients. In fact, many researchers are actually starting to dub digital inclusion as a super social determinant of health because of the importance that it really plays in determining health outcomes and also bridging gaps in healthcare disparities. So for us personally, especially on the health equity side, we work with a lot of health platforms like Find Help, Unite Us, and NowPow, which provide technology, infrastructure, and solutions to connect patients as well as their support systems and provider stakeholders, with a wide array of socially directed services and what we consider to be more holistic care, right? So
Mhm.
support and resources for food insecurity, housing, domestic support, mental and behavioral health, and many other community-based resources, just like in the example that I was providing. So that's one way that we can really be able to leverage digital health to help in those community partnerships and connections. Something else that we're really looking at is how we can use more medical interpretation services like language access services to provide folks who do not necessarily have English proficiency, to be able to provide them with seamless, reliable, and accessible accessible interpretation services, so that they're able to understand, when their provider is speaking to them, that they're really able to understand what's going on in their care. And we use the word interpretation specifically because we want to make sure that whoever is interpreting for them understands the context of the situation versus translation, which is more of a literal, direct, this is what this word means. And so we really focus on that interpretation side, and we're looking forward to leveraging how technology can assist us in that realm as well.
Yeah, and absolutely. And as we kind of wrap up this session, I wish I definitely had more time to dive into this with you. But what are the specific needs and challenges that health systems face when it comes to implementing digital health solutions in this context of value-based care and health equity?
Yeah, that's a great question. I do really believe that because of a lot of institutional and structural issues, many people from historically marginalized communities continue to lack access to the internet or the skills
Mhm.
needed to fully engage with digital health tools like the patient portals and apps that we were talking about. So I do think that it's very important to design health technology to meet the needs of these individuals. And by doing so, we really need to take that health equity perspective. Discussions about health equity oftentimes focus on technology, but it's rare that health technology focuses on health equity, right? So we really are appreciative of this space to talk about this. We talk a lot about AI and using predictive analytics, and it's great to leverage that. But how do we also still keep in touch with the fact that a lot of patients still require that human aspect, right?
Right.
For example, if we were to do a social needs assessment on a patient with a kiosk, or if they were to fill in those answers with an app, how do you still personalize that in a way that you're able to still touch the patient and talk to them, be able to let them know that you are a human being that's interested in preserving their dignity and humanity,
Mhm.
maintaining that compassion. So those are all things that we're really fascinated with and exploring as we age into this, world of technology, but also figuring out how to leverage it, but still humanizing it at the same time.
Absolutely. No, I love that. Definitely taking a more humanized approach to this in 2024 and beyond, I think is definitely the way to go. Well, thank you so much, Ashley, again for sharing so much of your important insights and leadership on these topics. And it's just great to seeing what great work you're doing for the Texas community, especially in terms of nutrition and, like I said, eliminating those food deserts. So thank you so much, and I hope to have you on again in the future.
Thank you all. Have a great one.